We heard this morning on the news, Paul, that in terms of close contacts outside your households, confirmed cases on average now are only having one close contact. So that was 30 at one stage. So this is a huge change in people's behaviour, but the numbers are still resistant. Is that just because the transmission is so widespread, or is there an issue with this level of lockdown that it's not working?
No, I think it's what we kind of described consistently as the lag effect. So we do know people have significantly changed what happened over Christmas. I guess over a 7-day period we would see the average contacts just below 3. And that's good. That strongly indicates people are doing exactly what we need people to do. But that does have to take time to take effect, both in terms of the cases and particularly a stronger lag effect in terms of the impacts that it has on our hospitals. So the points that we have been consistently saying is, in fairness to everybody for the actions they're taking now, nobody can change what's happened in the past and those case laws that are coming through. But from today, we can change what happens in our hospitals in the next 2 to 3 weeks.
Yeah.
And that's how important it is. And I know I've been on a few times with Jakira. I hate having to say relentlessly what we need people to do, but it does matter, and the public health actions that people will take will save lives in the next couple of weeks.
And talking about saving lives, we know the numbers in hospitals, they're higher than they have ever been. Almost 1,800 people in hospital at the moment with COVID-19. And you yourself have come out and said we have never seen this number of people in ICU in Ireland with the same condition all at the same time. We appear, when I watch the numbers, to be climbing by about 10% in terms of hospitalisations per day. That's what it looks like to me as a relative layman. We expect that to peak next week. So we are still looking like the 350 probably in ICU as the peak. Are we able to cope with that?
Yeah, well, two things. Look, and we'll have figures in the next half hour what it is this morning, but as of last night, 1,785, you're correct, which is more than twice the peak of the first peak in the first wave. 171 people in ICU. So, a very significant strain, relentless strain on our hospital system. Just specifically related to your question on ICU, what we have done is scaled up more available ICU beds. So you'll be familiar with this figure of about 286 beds across the country ICU. That's now standing at 302 with the great work by our ICU teams, the nurses, doctors, etc. We have this morning, as of last night, 32 ICU beds available across the country, adult beds, and 5 paediatrics. So we have not gone into what we would call our surge capacity on beds.
Okay.
But if the level of projections of what we have currently in the hospital transpire into ICU beds, that will increase absolutely, probably close to that 350.
By my reckoning, though, if we've 32 beds and we're increasing by about 10% per day, we're out of beds by the weekend.
No, we don't expect that to happen whatsoever. There is a different lag effect in terms of the hospital cases rising, as you just said, by 10%, but the timing of that transmitting into ICU.
Okay, so
should also point out, just for your listeners, we do have over 200 people who would be also receiving what we would call advanced respiratory support, so oxygen levels, and in some cases high flow oxygen levels outside of ICUs.
Yeah.
Sometimes on high dependency on wards or beds, or sometimes even in the ward itself. So, the level of sickness that's associated with this time, and I know in the numbers, but just what our nurses and doctors are saying, high level of younger people really very sick, high level of older people now coming in with advanced level of sickness, families being treated, mothers, fathers, partners, daughters, mothers, fathers, just all combinations of families being treated together in the wards, something our hospital system has never seen. So, it's really important what the people are doing. Nobody wants to get this horrible virus. But if you do, our hospital systems are still there for you.
Okay, so you sound reasonably confident that we're coping, whilst maintaining obviously the seriousness of the situation being very real at the moment.